Okay, so we're going to start with the scenario, and Dr. Kiran, you can unmute yourself and speak, please. Okay. Before we start, there is just something I want to show you. Okay. Just please confirm to me if you're able to see the shared screen and hear me properly. Anyone just respond in the chat box that you can hear me properly and you can see the screen I shared with you. Hello? Any feedback, please? Can you see the screen?
Yes, Dr. Another.
Okay,
Yes.
thank you very much. So, doctors, before we start with the scenario, I just want to show you the plan of our course. Is that everything is built up according to, first of all, there is a brief PowerPoint presentation, including all the key steps and approaches which you should follow whenever you face the task. Because, you know, exam scenarios are not very much predictable. It's important that you know the general outline, okay, and know how to approach the scenarios, but the concerns and the questions of the examiners and the details which are inside the scenarios, all these varies from diet to diet and from scenario to scenario. So it's very important that you understand how to approach whatever scenario you are facing, and that you have the knowledge you need about the ethics and law to discuss and to justify your answer and to explain yourself in the exam. Okay. So as you can see, this slide is from the explaining diagnosis lecture. Don't bother yourself with the blue column. I just want you to concentrate on the green column on the left side here. Okay, so this is the interview structure which we follow. This is the general backbone for all communication stations. In the exam, you have to follow these steps. All right, examiners are waiting for you to fulfill all these steps professionally to guide your discussion. Of course, there's going to be a medical management plan. There's going to be an ethical issue inside the scenario, different concerns of the surrogate. But however, this is the outline of the structure of the interview which you have to follow. All right. So here, I just want to remind you the steps where Dr. Kiran needs to follow now when practicing this scenario. All right. So the interview structure is that you have to start greeting the patient, of course, then confirm the patient's ID. Why we confirm patient's ID? For two reasons. Because first of all, we have to increase the bonding with the patient, and number two, just to make sure that you are talking to the appropriate and great person, because of you have to make sure that you are not breaching confidentiality, of course. And then you introduce yourself and your role, which is given to you in the task card. After that, start establishing rapport, just asking how they are doing now, just to break the ice between you and the patient. Then you explain why you are here today. Why are you meeting today? Okay? Then ask the patient about his understanding. This is a very important step, okay? This will eliminate a lot of confusion from where you start your scenario in the exam. Just by simply reflecting the question to the patient, ask them about what do they understand about what's going on so far? What do they understand about their medical problem so far? Let them speak, okay? After that, ask them about their expectation. They will tell you, for example, I had a tummy pain, I visited my GP and he requested some investigation, and then he sent me to your clinic to have a snip taken through a camera test, and I'm here today to know the results of this snip. All right, so here, before you break, for example, the bad news of having cancer or whatever the scenario is, ask them. ICE here stands for ideas, concerns, and expectations. Ask them if they have any idea about the results. What do they expect? Ask them about their expectations about the results. Sometimes the surrogate will say, well, doctor, I'm afraid it's cancer. They already have expectations. All right. Sometimes the patient doesn't even understand what's going on and why this snip was taken. So here you have to take him back and explain the situation, okay? This is not for you. This step is very important for you so that you don't get shocked when the surrogate tells you that he doesn't know anything, that you are not surprised that you have to break bad news. So from here, you know how you will proceed further, okay? So this is a very important step. Don't forget it. After that, do your task. Of course, your task could be either to break the bad news, explain the diagnosis of a given disease, or explain a procedure, or for example, explain a situation like, for example, a medical error which happened in the hospital, or your task could be requesting a post-mortem examination. It could be simply for example, explaining palliative care. I've been sending you some tips and notes on the WhatsApp group if you were following since yesterday. So it could be whatever the task, it can differ from scenario to scenario. Okay, so this step, it differs from task to task, and I'm explaining all that throughout the course lectures, okay? Like, for example, if the task was to explain diagnosis of epilepsy and discuss your management plan, so we have to follow specific steps for explaining the diagnosis, but this is not what we're going to do today. So that's why don't bother yourself with this column, because it's variable from topic to topic and task to task. So again, the backbone, back to the backbone. After that, you discuss your management plan. There is always a management plan which you have to discuss in communication stations. So the steps in the green color are common in all scenarios, okay? So discuss your management plan, then assess if they have any concerns or other ideas, how you can help them more, any expectations. Are they happy with your explanation, or do they have any further questions which you didn't mention so far? Then ask how this will affect their life, provide support, okay? So here it's time to, of course, most of the scenarios you have to ask about the effect of the disease or the news on the patient's life, all right? Which means that you have to ask them the social questions. It's not taking social history, but you have to ask, for example, well, how it will affect their job, their family, their life, their future plans, sorry. For example, how it's, depends on the disease, okay? So the effect on their life, and you have to provide support. Providing support is through variable means, depends also on the scenario and the disease. Providing support, social support is a support, okay? It could be financial support. Patient who's losing his job because of he's not able to drive anymore and he is a heavy vehicle driver, okay, he needs support as well. It could be rehabilitation service support, okay? It could be, for example, physiotherapy. It could be Macmillan nurses. It could be it could be support groups. It could be medical societies, all right? So there are different ways to provide support. Then summarize the discussion or ask the patient to recap. What did they get out of this discussion today? You have to make sure that they understood what you have been discussing, okay? They are not left behind with any unanswered questions. And then end the consultation professionally by giving contact details, giving the patient written information about, like in the form of, for example, pamphlets and leaflets and websites to where they can refer to for further information, okay? And also give them another appointment or a referral appointment or whatever the scenario is telling you, okay? And thank the patient, and then that's the end of the scenario. So now I will show Dr. Kiran his scenario, okay? I'll give you, Dr. Kiran, I'll give you a few minutes.
Hello?
Yes, hello.
Hello?
Yes, hello, how are you?
Yeah, I'm fine, ma'am. Actually,
yeah.
I was not ready, actually.
Yeah,
Sorry.
I will give you 3 minutes to read the scenario and plan your answer. Is that okay with you?
Yeah, can you choose another volunteer?
All right, okay, no problem.
Okay, thank you so much.
Okay,
Yeah.
well, I'll see the chat box. I guess I have the voice is far. Okay. So anyone else, doctors, want to try?
Okay, Dr. Another, can I try?
Yes, just a second to adjust the voice sound system of the laptop. So here, is my voice clearer now? Is it
Yes.
more clear now? Okay. So, we have
Dr. Galal.
Dr. Jalal.
Yes.
Okay. Can you see this in
But
a
but the writing is small. It
now?
cannot be big. Yes. Okay. Okay.
Is it clear now?
Yes.
Okay. So I'll give you 3 minutes. Okay. Please plan your answer, and then we will start. And then I will give you the comments about your performance and extra notes. Okay. So, Dr. Jalal, are you ready?
Just for a minute. Just for a minute.
Okay.
Just 1 minute.
All right.
Okay, Dr. Anada.
Okay, you can start now.
Yes. Hello, Mr. Turner.
Hello, doctor.
Uh, you are 48 years old. That's right?
Yeah, that's true.
Okay. Can I ask you first, what do you know about your condition so far?
Well, I don't know. I just the last thing I remember was that I found difficulty with breathing, and then I just I just collapsed, and I found myself here in the hospital with all these drugs around me, and that's all I know. I don't remember anything else.
Okay, I am sorry to hear that, Mr. Turner. Let me first to explain to you what happened. You have been admitted since 2 weeks with severe shortness of breath and the cough, and then because of having severe weakness of your respiratory muscles, and you cannot breathing very well, we put you on a machine to help you breathing and assist you in your breathing for saving your life. And we did some investigations during your admission in the intensive care, and we did camera tests and some blood cultures and sputum culture. We found, unfortunately, that you have a bug in your lung, which cause this severe infection to you. Is it all right, Mr. Turner? You
Okay.
are you are you are understanding what I am said?
Yes.
Okay. Uh, then when we sent for the culture of your sputum to see what is the cause of this bug, as because actually this bug occurs in the patient who have a weak immune system, and it is unusual to see in patients who have a good immune system. So we are suspecting that you have what's called HIV infection, which occurs in the which means that your immune system is very weak, and that's why you become infected with this bug. Okay.
Okay.
Okay. So we when we did this test, we found that you are unfortunately positive for this HIV.
What do you mean, doctor?
I mean that you have positive test for HIV, which is a disease of weak immune system.
But who gave you the right to test me without my permission?
Actually, Mr. Turner, during while you are admitted on the in the intensive care unit, and you are on the machine, and you are not conscious of the surroundings, and you are sedated. So we did this because this in the best interest of you, and we need to find out what is the underlying cause of this bug infection. That's why we made this as a team. We decided to do this test, as it was at the time in the best interest of you, and we need to save your life and to start the treatment as soon as possible. Do you understand this? Get my point, Mr. Turner?
Yeah, but what made you think that I have HIV? Is it just because of that difficulty in breathing and that bug? Just that?
Let me explain to you, Mr. Turner. This bug occurs only in specific patients who have a weak immune system. That's why first we are suspecting, the first priority to have this infection with HIV. So based on that, we did this test to make sure and confirm that you have this, and to start immediately, as well as I told you. Okay, Mr.
Yeah,
Turner.
yeah, okay.
Then when we started treatment for HIV for you, we moved the machine, as we found that you have improved already on our treatment, and now we are in the world. That's why we find that your health is improving and you are responding well to our treatment for HIV. So it was good for you that we have started the treatment as soon as possible.
Okay.
Okay.
All right.
Uh, so uh, so let me ask you, Mr. Turner, about what's your job, please?
Yeah, I'm a businessman.
Okay. And can I ask you personal questions, please?
Yeah.
Do you have any extramarital relationship or unusual unprotected sex with sexual relationship?
Yeah. So yeah, I do.
Okay. Um, Most probably this infection occurs because of this relationship, Mr. Turner. Unfortunately, you got this infection, and according to our test we do, we have confirmed this diagnosis, and you are now already started on the medication for HIV. Uh, Okay, you understand me, Mr. Turner?
Yeah. Okay.
Okay. So regarding the treatment of for HIV, it has some side effects as well as benefit for getting rid of HIV. As it will continue for several months, we need to keep an eye on you and keep close monitoring for these side effects. And we need to do regular blood tests for you to see if you develop any side effect, any of these side effects, like complete blood count to see if there's drop in your platelet count or hemoglobin or WBC count or white cell count, and to start immediately if there's any complication. And also, we need to do some liver function tests regularly also, as it may cause some elevation in your liver enzymes. That's why we need to do it also. And also, it may cause elevation in your blood cholesterol and triglycerides. So we need also to do this test to see if you develop any of these side effects. Also, sometimes some patients develop rashes, like an allergic reaction to these medications. We need also to follow these side effects and to pick up early as soon as possible. And also, we will follow up, you will need follow up with infectious disease doctor to see you regularly, and to see what is the progress of your condition, and to follow up with him. And we also will follow up from our side. We will see how is your condition of the chest is going on, and if you need further adjustment of your medications. Um is it all right with you, Mr. Turner?
Okay.
Can I ask you, Mr. Turner, about with whom you are living?
I'm married. I live with my wife and my I have two daughters.
Okay. Mr. Turner, according to this condition, which is highly infectious disease, uh, I advise you that you should inform your wife about this disease, because it can be spread to her, and she might get infection, and this will be risky also for her.
No way
Uh,
I'm gonna tell her, doctor. I'm not gonna ruin my marriage. You know, There's no way I'm going to tell her. No.
I I understand and I appreciate your concern, but Mr. Turner, you know, yeah, you don't want to hurt your wife and cause harm to her, as she's your beloved wife, and you are taking care of her. That's why it is best for your relationship that if you tell her about your infection, and we can help you in that if you need our help to sit with you and your wife in the same setting, and we try to explain to her further, and if she needs to know what's going on, and she needs more information about what happened. So this will be better than if she gets the infection and later on she will suffer from this situation. Okay.
No, no,
Is it
no
all right?
way. No, I'm not going to tell her.
Uh, okay, Mr. Turner, I understand that very well, but this uh, this kind of infections, if it is it will documented in your file, and if your wife gets the infection and later on if she discovers that you have this, you will be in big problem, you know. Your wife, she might make a complaint against you at the time.
You have 2 minutes left.
Okay, so Mr. Turner, why you don't want to tell her exactly?
Because I'm not going to ruin my marriage, doctor. I have a family. If I told her, she will break up with me.
Okay, but Mr. Turner, your relationship, it can be, it can continue if you tell her the truth. There's nothing to hide from her. She is your wife, and she has the right to know it. So I think it is better idea. Also, if you sit with my consultant to help you regarding this issue, and HIV disease as a disease is now treatable disease, and will give you some leaflets, brochures, and websites about this to show you how many people that are living with HIV and treated completely from it. So you will find you will find you will live easy life, and you will not suffer anymore later on. So don't be afraid from this disease. It will be treated, and you will live normal life with your family. So we are here to help you, and giving you the best of care, and also your family and your wife.
Okay,
So
your time is out. Your time is out, okay? But I will give you 1 more minute to finish what you want to say.
okay. So if you would like to sit with my consultant to discuss with you, and try to find a solution regarding telling your wife about your disease, and he may help you in this issue if it's okay for you, Mr. Turner.
I don't
Is it
know.
right with you?
What if I didn't tell her at all? What will happen?
If you didn't tell her, she and if she gets this infection later on, this she might make a complaint against you, and it will be like a case, and you will be uh, in the court later on. That's why I need to help you before this problem become difficult.
Okay, time is
So,
out. All
okay.
right.
Mm.
Uh,
Thank you, Mr. Turner.
Okay, thank you. What is the ethical issues? What are the ethical issues in this scenario?
The ethical issues, the patient autonomy is has the right to know full information about his disease and to take the decision and discuss the decision of and the plan of management with the team. Mr. Turner has the right to accept or refuse the treatment for HIV according to him because he has full mental capacity. And second thing, beneficiaries, we did the HIV test for Mr. Turner in his best interest to know what is the cause of the new status-carrying pneumonia infection. And we started the treatment for HIV once we know that he has HIV positive test. Malefactions that we don't want to make harm to Mr. Turner by not doing the HIV test, and that's why we did it for his benefit. And also we put him on the mechanical ventilation once the patient was deteriorated, and this was good for him. Regarding justice, we are treating Mr. Turner regardless his age and sex and color or religion, and we did the best treatment for him according to this.
Okay, if he refused to tell his wife, will you breach the confidentiality of this patient?
I cannot breach the confidentiality of the patient, but I will write in his notes in his file that has, of course, infection, and I will refer him to the consultant, to my consultant, to discuss with him also this issue, trying to convince him to tell his wife. And if he still refuses, we need to refer him to the legal department or patient service social relation to discuss with him this issue. I think. Sorry.
Okay. All right. I will, before I explain the scenario, I will just give you feedback about your performance. Okay. First of all, I think you did very well, but pay attention to the time. There are some things that you need to concentrate more about when you do the discussion. Okay, please try, first of all, as you made the introduction, you greeted the patient, you introduced yourself and your role, and then you didn't establish rapport, you didn't set the agenda, all right? You didn't explain to him why you're here today, okay? And then you started to ask him about his expectation about his understanding about what has been going on. I'm following the steps of the green column now, okay? If you follow these under the stress of the exam, you will find it as a guidance to follow a strict ordered plan of your discussion in the interview structure. All right, so he said that he was not oriented about what was going on, and you explained you explained very well that he had a chest infection and the bug and everything that was done, but you were using sometimes some medical jargon, so please pay attention to that. He does not know what's the meaning of culture and sensitivity. Okay. All right. You could say special test, for example, to know the type of the bug. All right. You said you were sedated. Instead, you can use the word you were keeping asleep. You were kept asleep. All right.
Kept asleep. Okay.
Yeah. You said infectious. Instead of infectious, you can say contagious. All right.
Okay.
So try to pay attention to these words. Okay, this is for the first thing, and then this is the breaking bad news approach. You have to use a warning shot. You have to break the bad news. and then you have to give the patient a pause or the golden silence. And after that, you go on by empathizing and assessing his emotions. It's shocking. After that, you go on by explaining your management plan. Okay, so you just jumped into the investigation result, and it was very fast. Okay, you didn't follow the specific steps for breaking bad news. All right.
Okay. Okay.
In the course, we have a special specific lecture for breaking bad news steps and approaches with the specific blocks. But however, this is not, there is no enough time to explain the ABCs and the basics of the approach for today and this evening, okay?
Okay.
But however, when you go on by explaining the, you break the bad news, you always have to give a warning shot, okay? Which is you prepare the patient for the bad news. And I'll tell you what to say in a few minutes, all right? You did very much explanation, but I was preferring if you were stopping every now and then, and for example, say I will stop for a few seconds to see if you have any questions at the moment, okay? And then every now and then you just stop and say, does that make sense so far? You told me a couple of times, are you following me? But just to make it an interactive discussion between you and the patient, just try to ask him more frequently, okay?
Yes, yes.
And so that he can give you his input and his feedback.
Okay.
You didn't ask me about my concern, right? Did you ask me about the concern?
Yes, I didn't ask about the concern.
You were you left it till the end, and you were run out of time, right?
Yeah, yes.
So that's why you can ask about the concern twice. You ask about the concern early inside the discussion. You can say, I will stop now for a few seconds to see if you have any concerns so far. And then repeat it again, just in case if you run out of time, you will get the concern mark at least. Okay, I know that you know, I'm sure you know that you have to ask about the concern, but sometimes this is what happens under the stress of the exam. You just forget to ask. All right. After that, you said that you have to inform your wife, and she is your beloved wife, and you are taking care of her. Okay. There is one more thing. Don't make assumptions about anything regarding the patient's relationships with others, okay? Maybe she's not his beloved wife. Maybe they are even fighting or separated or whatever. Okay? Hello?
Okay.
So,
yes.
Yeah, instead of saying, for example, some of the candidates, they say, he's your, when discussing organ donation scenarios, for example, they say, your father is a very good man and he is doing good deeds, and he must be wanted to donate his organ. I mean, don't make assumptions about the person. Maybe he was never a good person. Maybe he never did good deeds at all.
Yeah.
All right. So try to avoid that as much as possible. Don't.
But he will not say if he has a broken relationship or some problems with his wife. He will not tell.
Yes, but that's subjective. So don't use it. All right. It's specific, special and private for the patient's relationship. Whatever his relationship with his wife is, okay, he has to tell her. Okay, as long as he's still living with her and he's practicing sex with his wife, he has to tell her. All right, regardless of the quality of the relationship. So just avoid to be subjective. All right.
Okay.
Then always, you said that. Okay, I just wrote that note when he was refusing to tell his wife. I just wrote a note to ask why he's insisting not to tell her, and you already asked that after I wrote it. So you asked, but when he said that my marriage will be ruined, I have a family. Okay, you can say that we can help you in that regard. With that regard, for example, you can involve a marriage counselor if you are okay with that. If you don't have any problem, you are taking his consent here because HIV is confidential. Okay,
Yes.
you have to confirm
Yes.
to the patient that this meeting is very confidential, and no one else apart from the staff and you and the patient and the staff taking care of him. Nobody else knows about his disease. All right. So here he must tell his wife. This is a must. Okay. If he refused to tell his wife, you did a very good thing, which was you gave him a chance to, you offered help to support him. You offered that he can bring in his wife with him next time, tomorrow, for example, an urgent appointment to bring his wife with him, okay? So that you can do the breaking the bad news to the wife in his presence if you want to, or if he doesn't want to be present, you can do it for him. You can help him. What do you think about that? Always ask him what he thinks about that, okay? If he says, no, doctor, I'm afraid she will know, etc., then tell him that we can, for example, send an anonymous letter or anonymous message to his wife after his consent, of course, telling her that her husband has HIV, for example. You're discussing all this with his consent. These are some means of telling the patient, spouse or partner about the HIV status. If he still insisted on refusing, you have to offer help and support. You said that you can discuss it with my consultant if you would like to. All right, that's very good. But if he said that I am not going to tell her, no way, okay? He was insisting. So tell her, you said that it's very important because this may be legally important. She may ask for legal redress or cause some problems later on. But most importantly, tell him that, as you said, she has the right to know and to get tested and treated if she was positive. But then tell him that if he insisted not to tell her, then you will put us in a situation where we may need to tell her by ourselves. We, your team, because whenever there is a need to breach confidentiality in the public interest, just to supply here, ethically, if you find yourself you need to breach confidentiality to save someone else, like for example, a patient who is HIV and doesn't want to tell his partner or his wife that he is positive, and despite all your efforts to persuade him to tell the spouse or the partner by himself, you seek his consent, you offered help and support and everything, and despite that, he is not listening, okay? So you cannot let him harm his wife like that. We have to do something about it, okay? So here, you tell him that if he insisted, despite all your help, okay, then he will put us in a situation where we will need to tell her by ourselves. By that, you don't breach confidentiality by yourself. Instead, you will involve your senior colleague, your consultant, okay, and then we will do the breaching of the confidentiality in the proper way. We will document everything. But before you do that, you just give idea to the patient that we are going to breach confidentiality so that he doesn't feel that he's deceived if we did that, okay?
Okay.
So yeah, so the ethical issues here: autonomy. Patients, as you said, has the right to be involved in deciding about his treatment plan and everything. Okay, and then beneficence, that we acted in his best interest. And we did what is beneficial for him. Non-maleficence, we avoided harm. And justice here apply in the form that we have to be non-judgmental against HIV positive patients, especially those who are, for example, drug addicts or commercial sex workers, or dealing with prostitutes, or people who are usually who people are being judgmental against. You as a doctor, ethically, you should treat them like anyone else. Avoid being judgmental against these people. This is again how justice apply. All right, if you needed to breach confidentiality in the public interest, okay, in the interest of his wife, and then justice apply as well. One more thing. is that here I will show you. So here I want you to see the underlined words, okay? Here, medical doctor in the respiratory ward, that's your role. And then that was a diagnosis, and his condition was serious. So here, if the examiner asks you what is the legal issues in this scenario, the ethical issues, we already answered them. What are the legal issues in this scenario? Which is doing or acting in the best interest of an incompetent patient, because this patient, when we tested him for his HIV status without his consent, we did that in the best interest of the patient because he was incompetent. He had temporary loss of capacity. So you act in the best interest of the patient like that in two circumstances, either to save in life-saving situations or to prevent a serious, significant deterioration in the patient's health, of course, someone who is not competent, all right? So here we acted in the best interest of the patient, so we can justify our HIV testing without his consent ethically and legally, okay? So that was under the Mental Capacity Act. We acted in the best interest of the patient, of an incompetent patient, okay? Capacity is the medical term. Incompetent is the legal term of capacity. By the way, this was one of the examiner's questions. He asked, what is the legal term of capacity, which is incompetent patient, okay? A patient with capacity, the legal term of capacity is competent patient. The legal term of incapacity or loss of capacity is incompetence, okay? So
Okay.
here he came positive, so I will explain how you break the bad news in a few minutes. He's married, so here it's a must. He must tell his wife. One more thing, you have to advise him to tell his GP. It's not a must to tell his GP, but advise him, encourage him to tell his GP. It is a must to tell, he must tell his wife, all right, or partner who he is sexually active with. And encourage him to tell his GP. Why? Because he's taking antiretroviral medications. So in case if he got sick or he needed to take another drug, so that the GP will be aware of any drug-drug interactions, or, okay, and the GP himself, he has a duty to keep confidentiality himself. So encourage him to tell his GP. One more thing, you asked him about extramarital relationships, sexual relationships, and he deals with prostitutes, especially when he travels abroad in his business trips. So here you have to advise him to try to get in contact with those sexual contacts and tell them to get tested as well, okay? You have to mention these things. Now, contact with the, okay. Now, you fulfilled the task. Explain the events, the tests carried out in the ICU. Tell him about the positive HIV result. This is breaking bad news scenario, all right? Which is including other ethical and legal issues. So the legal issues in this scenario is acting in the best interest of an incompetent patient when he was temporarily losing capacity. Also, there might be an issue where we may need to breach confidentiality if he insisted, despite our efforts to persuade him to tell his wife. If he insisted to not telling her, then we may breach the confidentiality. So here, the ethical dilemma in the previous scenario was, in one arm, you have the patient's confidentiality, his autonomy. He's asking you to keep it a secret and not telling his wife. He doesn't want to tell anyone. And on the other arm, in the other arm, you have the public interest, the wife, the sexual contacts. If the patient was a drug abuser, also the people who he shared needles with should also be tested. Advise him to tell his contacts to be tested. Offer your help to do that. Okay, so in one arm you have autonomy, in the other arm you have justice. So you have to weigh them against each other. Okay, so if the patient refuses, for example, to tell, very famous examples are when they refuse to tell the partner or their spouse, the wife or the husband. So here, if they still refuse despite all your efforts and everything, then you can, if you decided to breach, you and your team, you and your consultant decided to breach confidentiality. So here, justice apply. You can justify your action by acting in the public interest. Okay. So that was the ethical dilemma. All right, now how to break the bad news in this scenario. When you tell him that, so first of all, you met the patient, you greeted him, you introduced yourself and your role and everything, set the agenda. You told him that you're here to discuss about some updates regarding his health condition. All right, so go on by asking his understanding about what has been going on so far. Okay, and then listen from his point of view. What does he understand? After that, okay, remind him how ill he was, that in order to save his life, okay, we had to put him on artificial ventilation. And because he wasn't improving and because his situation was very critical, then we had to do, as you said, the camera test and take a sample to test it, and it showed that it was a bug. And as you said, only immunocompromised patient has this bug, so that's why we thought in order to save his life and give him the appropriate treatment, we had to do this test in his best interest, okay? And then pause. You have to pause and give some time to the patient, a few seconds, to let the information and the news sink in so that he absorb what you said. Okay, then ask him, did any HIV infection ever cross, after that, tell him that we had to do the HIV test, okay? Because we were suspecting that that was the reason for the low immunity because of that bug, okay? And then pause and let the news sink in. Ask him about the possibility of HIV infection. Did it ever cross his mind before? That's the warning shot, okay? So here, before you say that it was HIV positive, you told him how sick he was, that we did a camera test, who isolated the bug, certain bug, which made us think about HIV. That's why, in order to save his life, we did the HIV test. And then ask him, I would like to ask you a question. Did it ever cross your mind or ever come to your mind to take an HIV test before? Now he knows. In fact, he knows that he's doing something wrong. He knows that he has multiple sexual partners, okay? So, or usually they're drug abusers or homosexuals. They have an instinct or internal feeling that they might be at risk. So that's why we asked this question to them as a warning shot. Did it ever come up to their mind to take an HIV test before? You will say yes or no, whatever, okay? So then break the bad news here and give him the results. Tell him that, well, we did the test and the results came, unfortunately, it was positive, okay? So then give him the golden silence and let him absorb the information. Okay, and then ask him if he is right to continue talking about this now. Confirm that this is confidential, all right? Confidentiality is preserved. Then, now here, ask him about whether he knows any risk factors that he has been exposed to before, all right? And he will say if he has ever had sexual relationships or so. You asked him, I want to ask you a private question. So here is the trick, here's a tip, okay? When you face a scenario where you need to ask about STDs or such private question, even in history taking, this is the thing, this is how you do it. You start by asking about risk factors which are less intimate to more intimate questions. Like, for example, ask the patient, would you mind if I ask you some questions about your lifestyle? No, I don't. Okay. Do you smoke? Do you drink alcohol? Do you use illicit drugs, for example? yes, I do. How do you take them? Do you smoke the drugs, or do you inject drugs? Are you sharing needles if they are injecting? Okay, ask them about piercing, tattooing. Okay, these are also other means of transmitting infection. It's a blood-borne disease also. Okay, so ask him first about less intimate questions, and then go on by, well, I would like to ask you a private question. If you don't mind, I usually include it always in my discussion with my patients. Do you have any sexual relationships, unprotected sexual relationships? And when you ask about that, if he says yes, you have to ask, is it homosexual or heterosexual? One partner or multiple partners? Okay, is it protected or unprotected sex? All right. So he will say yes, he has. And these questions are mainly in much detail, especially in station 2 when you take history. But in station 4, ask briefly about risk factors like injecting drugs, illicit drug abuse, if they aren't sharing needles, or tattooing, or piercing, or sexual relationships, okay? With your wife, or do you have other sexual relationships? All right, just briefly go through them. Then, from now on, you break the bad news. You did your proper introduction. You assessed the patient's understanding. You explained why we did the test, all right? And then you break the bad news. You gave the warning shot. You give him the bad news. You asked about the risk factors. Now you have to explain your plan of action. What's going to happen? Because patients, when they get sick, the most they are concerned about is how you are going to fix them, all right? So here, tell him that he has been started already on antiretroviral treatment and he's doing fine. That's why he's now talking to you. And he, as you said, now he's in the ward, for example, he's not in the ICU anymore because of the good effect of the drugs. Okay? Explain that he has AIDS. All right? Sometimes the surrogate will ask you, is it AIDS, doctor, or just HIV? Is it the same as AIDS? So this patient has AIDS. So you have to explain to him that he needs to have some blood tests to monitor his response to this treatment. It means that he has a severe HIV infection, okay? And many people, they make good prognosis, they do very well, and live nearly normal life expectancy with good quality of life on these drugs, okay? Then ask him who he wished to discuss the test result with, okay, like his wife. This is an entrance when you tell him that he has to tell his wife, okay? Reassure him that it's confidential, no one will know apart from you and your team who's looking after him, okay? And then, again, remember, he must tell his wife, and advise him or encourage him to tell his GP. It's up to him. Explain to him that it would be good, and your GP also has a duty to keep the disease confidential, all right? The future plan, when he will be seen again, who will follow up him, okay? The HIV specialist doctor or a specialist nurse in the infectious clinic, for example, okay? Arrange another time to come back and speak to him again in a later or near day to ensure that he recapped the information in the plan, okay? Advise him that from now till the time he tells his wife, okay, so sometimes the surrogate will not refuse to tell his wife. They will say, okay. So advise him to advise him that he should not have unprotected sex with his wife until she knows, okay? Tell him that he must tell her in today if possible, or in a very close date. And again, I'm not going to explain that again, okay? Already explained. And then address any issues they have, any concerns. Ask them if they are have any further questions. Are you happy with my explanation? Do you have any questions which I didn't explain before? Always make sure that the patient has everything cleared for him, okay? And then again, prepare yourself for the ethical and legal issues, okay? What else? Just to make sure that we didn't miss anything. Now, the patient may have, if you asked me about my concern, which you didn't because you were lack of time, I would tell you that I'm a businessman, okay? And I deal with many insurance companies. So what's gonna happen with my insurances, all right? If the patient who was diagnosed with an HIV disease, for example, and he asks you about his insurance, life insurance or whatever, okay? So insurance is taken out before the date of diagnosis. They will be honored, but you have to advise them when they take out another insurance or apply for another insurance or renewing the insurance, they have to be open about their disease, okay? And that if the, regarding disclosure of the patient's information for employment or insurance here, you must make sure that the patient has sufficient information about the consequences of a disclosure of such information if they are required by law or in the public interest, okay? So here, you must make sure that the patient has sufficient information about the consequences of disclosure of this information and obtain their written consent to do so. Make it clear to the patient that you cannot hold any relevant information to the request, and to offer to show the patient a written copy of your report if still refusing to disclose the information to the relevant parties like the court or law or if requested in the public interest. Tell him that you may need to breach the confidentiality if it was in the public interest or required by law. All right, so that was the end of the scenario and the related ethical issues.
So Nada, please.
Yeah.
I have a question, but regarding, I shouldn't talk about more details about the side effect of drugs of the medication of HIV because I missed some points in the scenario, so I shouldn't talk about in details about the drugs for HIV or medication side effects like this in this scenario.
Well, you tell him that he has been started on antiretroviral treatment or these treatments which are specific for HIV, okay? And on other medications for the pneumonia or for the chest infection, okay? So just give a general idea about that. You can say that these drugs may have some side effects, but they are generally tolerable, okay? And many patients are living while taking them and doing good progress, and they have nearly normal life. We will explain everything to you in the follow-up visits, and or you will be followed and supervised under the supervision of the specialist, HIV specialist.
Oh.
You don't have to go in too much detail
Yes.
unless it was your task, okay?
No,
but if it's
because it take time.
Yeah, you will miss some points and you will be run out of time, okay?
Yes,
so
yes.
It might be the concern of the patient. Sometimes it's the concern of the patient. He may ask you, what are the side effects of HIV treatment, doctor? Okay, or if the task was to explain the HIV medication. All right, so here it varies according to the task or the concerns of the surrogate. This is what you have to adjust your response to. But in this scenario, no, you don't go through the details, okay?
Okay, thank you, Dr.
Okay, welcome. So that was the end of our session today. If you have any questions, please ask me. Yeah, also he said, here are some questions. Also he said sputum, here are some comments from the doctors who were following us while we were practicing the scenario. So me and Dr. Jalal, sputum which was not mentioned by bronchial washings. Yeah, you can say, instead of saying sputum, even sputum is a medical jargon. Anyway, you say phlegm instead of screened. Okay. Yeah, you should not assume things which are not mentioned in the scenario. It was mentioned bronchial washings, so you can say bronchial washings to the patient. It's a clear word. Okay. For the question about confidentiality, I think I already answered the questions. Okay. All right, children, here's the question. Do children need to be tested? Well, children need to be tested. Why? It's not a must to test his children, because unless they have been exposed to blood transfusion from their father, or piercing or tattooing or something like that. Okay, they have been exposed to that risk of infection. HIV is basically a sexually transmitted disease, or if they are sharing needles with their fathers or something mentioned like that, with their father or something mentioned like that, yeah, that would be possible. Okay, but children are usually not to be tested or screened. It's specific. Okay, sharing needles or sexual contacts. All right. So thank you for attending, doctors. I hope you found this session helpful. There are many things, or many lectures and scenarios preceding this lecture, actually, in the course. This lecture comes. This is the 5th lecture, actually. It's preceded by 4 full lectures and many scenarios. So I hope you got benefit of it, and if you have any questions, just you know where that we are still in contact on the WhatsApp group. Please, doctors, add any and invite any candidates you know, so that we can share most information. And for the August course, it will start on August 15th to August 29th. If you are interested, please contact me on the WhatsApp number, my private number, and you can add any candidates you want to add in the groups. It's general group, and see you in our next free lecture. I will announce for it in our groups. Okay, thank you very much, and take care.
Please, Doctora, please. Her HIV test was carried out without permission of the patient.
Yes.
This point should be discussed with the patient or apologize for him or not.
The patient was angry because he said, "Who gave you the right to test me without my consent?" So here he explained to him that I understand your concern. Or I appreciate your concern, but this test was done to save your life. Here, that's why we explain how critical his condition was. We explained to him how ill he was. And because of that, because to save his life, he was not able to, he was not conscious. So in order to save his life, we had to do this test because we found a bug from the bronchial washing, which was responsible for his condition. And we had to start the appropriate treatment based on the HIV test result. And that's why he's better now, and he's conscious again, and he's doing better. Okay, so even you just explain that to the patient. Okay, it's not a medical error. We didn't do an error to apologize for him. No, legally this is your job. You had to do like that. If you didn't, that would be considered withholding treatment from an incompetent patient. Okay, so if the patient is incompetent and he comes in a life-critical condition, he was dying, okay, and there was no advance directive, known advance directive refusing mechanical ventilation or any intervention in place. You don't know about any of that. It's not mentioned, okay? So your duty is to save his life. All right. There are so many details which are very important to know for cases exam, and many exam scenarios are built up onto these legal issues. It takes, I explain it over 2 days in my course. Okay, it's complicated. It needs to be explained step by step, supported by examples, but this is the general idea to answer your question, okay? I hope it's clear like that. It's not a medical error. We didn't do a mistake by not taking his consent because he was incompetent, okay? And in order, we did the best interest for the patient. This is our legal duty as doctors. The responsibility of the patient lies with the treating consultant. He does the consent, okay?
Okay, okay. Thank you very much.
Okay. So we'll stop here and goodbye, everybody. Take care.